Violini motoi mai haate Kitasi ukulele Furta moi mahisame Kalaneti hula ameriane Fanomo le oe piano tele violini moto oe mai hape Kitasi ukulele futa moe mahisame kalane tie hula ameriane Fanomo le oe piano pele violini moto oe mai hape Kitasi ukulele futa moe mahisame kalane tie hula ameriane Vai soa Sayone Ele ona ele kupulaki kaino maasi ete boli Deposita nova alma Ate amo e kakala palata si eluva de loto lava Como calvarie ia loto tempo e atamai Onde kita sidoni o mamani Deposita nova alma Ate amo e kakala palata si eluva de loto lava Como calvarie ia loto tempo e atamai Onde kita sidoni o mamani Mas só Sayone Ele uomona, ele tupulaki Ai nova asi ete noli Isa si matangi takanengi whakamaunga mei he tonga. O whalala he wha. Pea toka aki ene alaha. O manongi e whiangi aki oi ea. He whiume oi halatoa. Ke whekite kisi asola. Ke kumia e funga mohu e wha. O kuhi whoatu e hala tai ala. O ka taito e la. Ke sui pihenga lula to ahina. Ka enonga e loto tala. Tuli whai maho te ki hina. Ke ne whai mai ai whakatolo. He whahina whatai mai whakura. Ke kahoa si a whewhine e maho. Isa si matangi takanengi whakamaunga mei he tonga. O whalala he wha. Pea toka aki ene alaha. O manongi e whiangi aki oi ea. He whiume oi halatoa. Ke whekite kisi asola. Ke kumia e funga mohu e wha. O kuhi whoatu e hala tai ala. O ka taito e la. Ke sui pihenga lula to ahina. Ka enonga e loto tala. Tuli whai maho te ki hina. Ke ne whai mai ai whakatolo. He whahina whatai mai whakura. Ke kahoa si a whewhine e maha. Tuli whai maho te ki hina. Ke ne whai mai ai whakatolo. He whahina whatai mai whakura. Ke kahoa si a whewhine e maha.
So that everybody could get all the great information that is relevant, for the community. And we're going to have Mark Ellerbrooks. He's going to talk about the eviction prevention program. Tigray Avantisen, he's the technical lead. He has the analyzing COVID data for the King County. And Kevin Lau, seasoned epidemiologist. So thank you so much for your patience. In about maybe 1 more minute, we'll be starting. Thank you.
La
welcome to the Pacific Islands broadcast. My name is Sylvia Aho, and I would like to welcome everybody, especially our special guests, for taking their time from the public health Seattle and King County. On a weekly basis, they have been helping us to provide information that is needed by the community, the Pacific Islanders community. Welcome, Christina Predix, she's the Public Health Information Officer. And also, we have Mark Ellabrook here, is with the King County today. And because of our time limit, I don't want to take much of your time. Pastor Noah, are you inside? I am seeing you.
Yes,
Hi, Pastor Noah.
yes, I'm here.
Oh, okay. All right. Yeah, could you lead us, with just a little short prayer so we can continue on? Thank you so much, everybody. Brandon, Catherine Lau, also Mark Ellabrook, and Christina, thank you so much for your patience. I would like to ask, as how we always start, to have Pastor Noah from Nigeria to start us with a little short prayer, and then we'll continue on.
Almighty and everlasting Father, we thank you and we keep thanking you again and again for all that you have done, even for your journey mercy, for the life that you have given us, and another great opportunity for us to have education of things that we ought to know to help us in our various communities. Father, come and take preeminence in all that we will do, that it might be glorifying to your name. We pray in the name of Jesus Christ. Amen. Amen.
Yeah. Brandon and also Mark, Brendan, and also I have Pastor Noah, and I have some people that will join us, like in a few minutes. We'd like to welcome Mark Ellabrook is with King County and is here today to talk about new eviction prevention program. For those of you that maybe non-English speaking, I'll just mention this, like in our language. Koe tala noa ni mo toko taha o kune lava toko nii. Ai kakai ko iau nau whe mau hanau toko ni ko ia ki he rental. So first of all, Mark Ellabrook, welcome again to the Pacific Islands podcast. And very sorry, Tino, because we always have the coconut time. For the listeners who have not heard before, what is the King County Eviction Prevention and Rental Assistance Program?
Yeah, thank you very much, and thanks for having me again.
Yes.
Yeah, so the King County Eviction Prevention and Rent Assistance Program is essentially a payment program for folks who have not been able to pay their rent to their landlord due to unemployment or another impact from COVID. The King County program will help pay that rent to make tenants current so that they don't face eviction from their home. And so it's a program that we've operated now since the fall, and we are doing kind of our next section of this program, and we are having tenants register now for part of that, and our plan is to begin making payments in July to landlords.
I'm going to ask the next question, and then we're going to switch over to Brendan and also Pastor Noah. And then I have JR, they're all from the Pacific Islands Community Association of Washington. How long will the applications be open?
Good question. They're open now, and we individual tenants can register on the King County website, and I will put a link to that in the chat here for folks. And so they can register. They can register today. We may need to close registration in the near future just because the demand for the program is really quite high. I think we're seeing, our estimates is that we have between 15 and 20, as many as 25,000 households registered as part of the program. So we may in the near future need to close that registration process so that we can ensure that we're going to be able to meet the needs of as many people as possible. So I would suggest if folks are not registered, or if they aren't sure whether their landlord has registered on their behalf, that they visit the website, which again is in the chat for folks, and we can hopefully you can make that available to your listeners so that they can get registered, and we can begin to gather their information and get them into the process for assistance. The way, just to provide a little bit of more context, for tenants who register as part of it, we do a weekly selection process for the number of people we can process that week. And so I think we're looking at, 300 or 400 people a week that we're able to process. So we will pick those folks from the number of people who are registered and then move those through and work with them. And then we will do that selection process every week. And so getting people in and registered is the best path for getting assistance through the program. One more point that I will make, and then I will let you move on. So we know that there's tenants kind of throughout the county who need assistance. We have identified this program really for folks who are lower income. So those are people who make about half of the average income in King County. And so that's for a household of 4, that's about $50,000 a year. And so we're trying to prioritize those folks as the people in greatest need who need assistance.
Thank you so much, for this great information. And that is very, very clear. A lot of the people asking that question. Pastor Noah, are you ready to ask a question, or Brendan? And I have JR. Are you listening, or you have a question?
Yeah, I do have a question. I know Mark has made mention of those who about the registration. I know that this program had run last year, I believe, and during that period, they were doing it like a lottery pool, whereby the selection is made through that system. Is it the same that is going on right now? Or, has you graduated to another form of selection?
Yeah, thanks for the question. There are actually 3 models this time, so we've added one. So one is, sorry, just a moment. I apologize. So we have a program for folks who live in kind of large landlord properties. We've got the tenant pool, Pastor Noah, which is going to operate similarly that it did in the fall, where folks will get kind of pulled in a kind of a selection process as you described it. And then we are working with a number of community-based organizations as hubs, where folks who typically go to those organizations can go and get assistance directly from those groups. And so one of the changes we made to the program based on feedback was really being able to provide an avenue for those community groups to be able to provide assistance directly for people that they work with. And I'm happy to provide information on those groups and who they are, so that information is available.
Thank you.
Yeah,
You bet.
Pastor Noah, you got it. Okay.
Yeah.
Brendan or JR, do you have a question right now, or you're not ready?
I have a question. Maloni, my name is Brandon. I go by he or her in the pronouns. Super grateful that you folks are here, especially you, Mark.
Yes.
I had a question for you today. So I was in the office. I'm the programs manager for leadership and spirituality at Piqua. And I had a family call in. It was a woman, a Pacific Islander woman, and she had called in and she was wondering about the rental assistance program. And she seemed kind of worried that her income or the family's income was, I guess, excluded them from assistance. And so I'm curious, like, are there what are the qualifications for folks to get rental assistance for their housing?
Yeah, thanks for the question. There is an income limit. So one of the requirements that we're putting on the program, and that is also from the state where we get a portion of the funds, is really prioritizing households that are earning 50% of area median income. And so what that means then, again, for a family of 4 in King County, that is, the limit would be about $50,000 per year is how much that household could earn. If you earn more than that, you wouldn't be able to qualify for the program. But if you're under that amount, you would be able to do that. There's a way on the website that I put the link to help determine kind of if you're at that threshold. And again, I think, we recognize that there is need, frankly, across the income spectrum within our community. And what we are trying to do, recognizing that, we're working to prioritize the funds among where the need is greatest. And so that's why we've set that limit at 50%.
Perfect. Thank you very much, Mark.
You bet.
Okay,
Thank you.
Thank you so much, Mark. Okay, when can people expect to start seeing the assistance, Mark?
Yeah, so Pete, we're working with tenants now, and so that process is tenants register, and whether they come in from their landlord or they register through the tenant assistance pool and are picked. We work through our community providers. They reach out to the tenants, make sure that all of their information is in the system, and so that level of assistance, as far as working with tenants, is happening now. Payments to landlords on behalf of tenants will start on July 16th. And then we will be making payments every week, kind of, several $1 million worth of payments on behalf of tenants every single week going forward. And so that's kind of where we sit in the process. Landlords agree as part of that process to, if they're going to accept payment from the county, that they will not evict their tenant while the tenants are waiting to be, or while the landlords are being paid. So there is protection there, even if we aren't able to get to a specific tenant in mid-July. So I think that's kind of a built-in protection that is available in that space as well.
Thank you so much, Mark. I know your time is very limited. Is it possible for the people to be evicted while they are waiting for the program benefits?
Yeah, good question. I think there's 2 protections available right now. One, as you may know, the governor extended the statewide eviction moratorium. And so that actually goes through September 30th of this year. So right now, tenants can't be evicted for non-payment of rent until September 30th, regardless of whether they're getting assistance through our program, some other program, or not. So that has gone out further by the governor's action. And then the program that we are operating, because we know that it still takes time for us to process payments, the landlords agree, as part of participating in our program, to not evict a tenant while we work on processing that payment. So it could be a couple months down the road and that we don't get payment out until that point, and that tenant still would be protected in that space because the landlord agrees not to evict while they're waiting for payment.
Great, thank you so much. We'll take a little 15-second here just to play a song before we continue on, with Dick Rain. But before we continue on, I would like to ask, Pastor Noah or JR, Brendan, do you have any other question before we switch to the next topic?
My question will be, you talked about the process. What is it involved in the process? Is there a verification process? Is there documentation that could be needed or something? So what will be the process?
Yeah, thanks for the question. There is a process, and so when a tenant goes to the website, kind of reads through that, sees that they're qualified, they go to essentially our data system registration process. They put in their information as far as, you know, where their unit is located. They are able to provide their documents as far as their lease or a copy of that lease, their income information. That's all in our protected system, so that then we are able to kind of work through the confirmation of that information as part of the process, confirm the payment amounts on behalf of the landlord, make connection to the landlord, and then ultimately make the payment. So that's kind of the process. We have an ability, regardless, frankly, of sort of whatever language folks speak, or if they have any sort of particular other kind of accommodations. The system is set up, and our program partners with community partners are set up to be able to work with folks who kind of have any of those complications as far as language ability to do that piece. So we have an ability to help folks kind of regardless of any of their needs for getting through that process.
Thank you so much, Mark Ellerbrook. We do appreciate, all this very important information to help our people in the community to know more about and learn more about the new eviction prevention program and how to get the rental assistance program if they're qualified for. I'll give you, the last minute, if you have anything else to share, that would be great too.
Yeah.
Before we continue.
Well, first, yeah, thank you so much. I have to say, so this is my second time being on the program. I love being on your program. It's great. So I appreciate the opportunity. I really do encourage folks to go to the website if they think they qualify and they are facing an ability to not pay rent, that they do go through the process of registering. I do think we probably will be in a place of needing to not accept registrations or close registrations in the relatively near future, just so that we're able to process the folks that we have in the system to date. So I just encourage people to do that and take advantage of the opportunity. And thank you so much for having me.
Once again, thank you, Mark Ellerbrook. You have been sharing a lot of great information that is very much needed in our community. And we look forward, to have another program with you in the upcoming future. Thank you also, Christina, for bringing all the stuff from the King County Public Health. Okay, thank you. And here's a song, just a nice Pacific Islanders melodious, song. And we do appreciate, Okay, Brendan, you can do a dancing, talk aloud song.
¿Qué tal hacer tu ropa? Y heua puto una etitoba. Onga ano tonu tu alopa. Uta angasi apine leyona leyona. Uta angasi apine leyona.
Talking about like topics and what's really best and what's benefit, and that's what the song is about. 10 seconds and we'll continue on.
Koe tala noa moe ongo ki he ane afi moe angai nofo. Ahoe au nofo kai au fuata ko kai whakanoa loto o mana wahoko ko e tala noa moe o momo ki he anea fi moe anga e nofo aho e au nofo kai au fuato kai whakanoa loto o ana
Welcome, Tigran Avantisen is a technical lead and working on collecting, managing, and analyzing COVID data for King County from many different data sources. So I know we do have a lot of folks, from the Pacific Islanders Community Association of Washington, and we had Tigran before in our program. So I will ask the first question, and if you know any questions, to ask about the COVID data here in the King County, feel free to come on. Hello, Tigran. Welcome back
Thanks
to
for
the
having
Pacific
me.
Islanders podcast. What do the most recent vaccination rates tell us about what is happening with the COVID-19?
Currently we have 72% of King County residents ages 12 and older have been vaccinated. And over the past 2 months, we've seen a sharp decrease in our incidence from 440 cases per week at the end of April to about 61 cases per week as of this week. So it's been a pretty dramatic decrease. And among the Native Hawaiian Pacific Islander community, 81% have been vaccinated in our county among Native Hawaiian and Pacific Islanders ages 12 and older. And incidence among this community has also sharply decreased since April, from about 82 cases per week to about 25 cases per week in the most recent data. So that's a pretty big drop from where we were just a few months ago.
Yeah, very. Okay. At this time, I'd like to ask another question while I have those folks, are waiting. What should people know about variants, and are they reason for concern?
Yeah, so the variants there's multiple variations of the SARS-CoV-2 virus. And, as the virus kind of spreads, it changes and, more variants kind of emerge. As of today, the CDC has 4 variants that they've identified as variants of concern because they might have increased transmissibility, lead to more severe disease, or offer reduced protection due to vaccines or other reasons. So the 4 main variants that we're seeing in King County are the Alpha, which is also called B117, the Beta, which is also called B1351, the Gamma, which is P1, and the Delta variant, which is B1617.2, which I think is in the news a lot recently. Right now, the Alpha variant is the most common variant in King County, but we're seeing a pretty sharp decline in the prevalence of this variant, and we're seeing a growing number of cases with the Delta variant. And one thing to note is we're sequencing a little under 20% of our positive test results. And in the past 2 months, over 85% of our samples sequenced were for a variant of concern. And a growing proportion of those are the Delta variant and the Gamma variant, and the majority still remains the Alpha variant. All of the vaccines that have been authorized for use in the US right now have been reported to be effective against these variants. And we continue to monitor both vaccine effectiveness among and how these variants kind of affect that over time.
Thank you so much, Dick Rand. That's really nice, to know about the data. And one question, with the King County lifted its mask directive like yesterday and today, Washington State fully reopens. Do the numbers show this is safe?
Yeah, it's a pretty big change these last couple of days. So currently, over 70% of King County residents who are eligible for vaccination have been vaccinated. And we're seeing some of the lowest incidence rates that we've seen since June 2020, which is when we had our lowest case counts, overall during the past year and a half. As more people are getting vaccinated, we can feel more comfortable and safer with things reopening. And a couple of things to note is that, children under the age of 12 aren't eligible for vaccination yet. And it may be important for us to continue to model masking and wearing masks for children, and to continue to protect the health of unvaccinated adults and those who can't get vaccinated because of their underlying conditions. And as we start to reopen, it's going to be more important to get vaccinated if you can, and keep track of the risks in our communities. Also, even though things are reopening, if you feel that you want to protect your unvaccinated and vulnerable family members or friends or community members, we can still do the same things we've been doing over the past year to protect them, including gathering outside, social distancing. You can still wear a mask even though the mandates have been lifted, and we can also improve our indoor ventilation to ensure everyone's protected.
Is Brendan still in? Okay, thank you so much, Dick-Rain. The King County lifted its mask, and I know that Governor Jay Inslee also, give the last 4 steps, to formally reopen. What about the variants?
Yeah, and with the growing variants, there's still, we're seeing kind of an increase in the Delta variant recently, which, is concerning because it's a little more transmissible than other variants, including the Alpha variant. It might be important, especially if you're unvaccinated, to continue to wear a mask and to take precautions to protect yourself and to protect those around you and your loved ones.
Thank you so much, Dick-Rain, for this great information. Do you have anything else, to share? I know we do have some listeners, that on just sitting there, but they wanted to ask questions, but they want me to translate. But we will do that, Anything else that you wanted to share about the data?
Only that, we need to continue to try to get vaccinated and promote the vaccine as much as possible. We've done a really great job so far to vaccinate as many people as we can. And we've hit 72% of those who are eligible. But overall, we're at 60% of the county's whole population. So the more people we can get vaccinated, the more we can protect the people who can't get the vaccine because they're children and they're not eligible, or because they have an underlying condition that makes it hard for them to get the vaccine. So the more of us who are able to get vaccinated, who actually do get vaccinated, the safer we can make the world, our county, and our communities for those of us who can't get vaccinated.
That is such a great explanation. I hope that everybody picked that information, of the targeting, to trying to get the vaccination, during this pandemic. And now we've finally come to a state, that the governor opened up, the state of Washington. And I think that we are at the 4th state, in the country. I know that this question here doesn't compare to your data, but I'm just asking, how do you compare maybe, I don't know, King County or Washington State to the other state?
That's a really great question. I think in terms of vaccinations, our county was one of the first to reach 70% vaccinations among eligible residents. And throughout the entirety of the pandemic, we've done a really great job of keeping our cases low and like emphasizing prevention as much as we can. We still have a lot of work to do, of course. But we can kind of be proud of the fact that we've done a really great job of getting the vaccine out and sharing it with folks, and especially for the Native Hawaiian and Pacific Islander community, it's really encouraging to see that 81% of this community has gotten the vaccine, and I think that's one of the highest rate. That's the highest proportion of any race and ethnic group in our county. So I think there's a lot to be proud of too.
Thank you so much, Tigraine. And I wanted to share this, with our Pacific Islanders. Ko ngai whamatala ko o mai ko e Tigraine, ko e tara, tola hitape Pacific Islanders. Ai ni ko na e wesia ko na sino. So ko me mahu e ngai ke mo ngawe ake kayu ngai hu and mo fai to. So for those of you that are tuning in, Pacific Islanders has the highest rate, that being affected by the COVID-19. So, trying to encourage everybody, please take your vaccine. It's very important, that you can protect yourself and you can protect others. And we're so glad, that we are here in the King County, that we have a lot of resourceful information and a lot of availability and a lot of other things, to assist you and me to get all our vaccination. Thank you so much, Tigraine. And really appreciate your coming in. And before we even coming down, I'm gonna play a little melodious, break, for 15 seconds, and then we continue on to our third topic with Catherine Lau. She's an epidemiologist, and so she will talk about, the response, with the public health. Okay, everybody, stay tuned. Thank you so much, Tigraine.
Thanks for having me.
Yes, absolutely. Once again, thank you, Tigraine, for sharing all this necessity information, and it's good, to keep reminding the Pacific Islanders community we have the highest rate that being affected in the COVID-19. and we need to listen and obey to all the things, that providing by the King County Public Health. Take your vaccination. We look forward to having you guys again. Mark Illabrook, Tick Rain, and now welcome Catherine Lau. Catherine Lau is an epidemiologist on the COVID-19 response with the Public Health Seattle and King County. I have the first question. Everyone 12 and older is eligible for a vaccine. How about protection for children 12 and under?
Hi, thank you so much for having me. Just to say who I am, I work with Tigran, and we're both really excited to be on the show. To your question about everyone 12 and everyone under 12, yes, unfortunately, they're not eligible for vaccination yet, and we still don't know quite yet when they will be. So in the meantime, it's really important. I think Tigran started to talk about some of these things, but it's really important to continue to do a lot of the protective measures that we've all gotten used to over the past year. So we recommend that in schools and in childcares, everyone continues to wear masks, just because that can help protect those children. And another really important thing that we can all do to help protect the children that we are around is to get vaccinated ourselves, because once, like you and I, are vaccinated, then that dramatically reduces the risk that we can give it to the children that are in our families or our communities. So getting vaccinated not only protects you, but also does protect those children. And like Tigran mentioned, just because the mask mandate is ending, you can still choose to wear a mask, and it might be easier if you have young children to continue wearing one as an example for them. So that's definitely still an option, and a great option if that works for you and your family.
Thank you so much, Catherine. Catherine, I have another question. What if an adult is unvaccinated or has an underlying condition? Is it okay for children to be around them?
Yeah, that's a great question. I know lots of people have questions about what exactly does it mean now that I'm vaccinated? And it's important. If an adult is unvaccinated, then they are still at risk, both of getting COVID themselves or of spreading it to others. So if it's an unvaccinated adult, then they should still try to take precautions. And that goes for them being around children too. So masking, having gatherings outside, social distancing, those are all important things to continue to do if you are going to be around a lot of unvaccinated people or a lot of children. And definitely, if you're going to be around both, then it's important to do all those other interventions besides vaccination.
Thank you so much, Catherine. I have a text, from this person here. Is saying that, because of this time here, it's a summertime, and most likely we don't really get cold or flu. We always get that during winter time. Do you think that after all we have the vaccination and a lot of people have been taking it, how about when it's coming to the fall season? Do you think it's going to continue on, or is because I think that sometimes the cold season is just a regular season for people to have the flu or the cold?
Yeah, that's a great question, and something we're definitely thinking about a lot at Public Health, trying to think about what is going to happen in the fall. I think the summer is a great time. Like you said, in Washington, we have pretty good weather. We can all hang out outside. And so it's a great time now to really take advantage of that and have our gatherings with our family and friends outdoors, on the beach. And when we get into the fall, we're going to have the weather changing and children going back to school and a lot of different factors that we're not sure how it's all going to come together. And so I think it's good to, not throw out your masks, but to hang on to them for the fall in case we do see a surge that, is not out of the question. But I think Tigran just put it in the chat, and it's a great point. The more we can do in the summer to drop our case rates, the better prepared we will be for the fall. So I think people, should, use this time to look after like their mental health and maybe see friends and family that they have been really careful about not seeing in the past. And in anticipation that the fall might be a time when we need to be more careful again.
Okay, thank you so much. I have another text coming that's somebody from outside of the state saying that are we taking the vaccine, for protection? What about the wintertime? It's almost like related to the last question that I just saying. Is it going to reduce or just the number is going to go up and then everybody claim that's a COVID-19, but that's a cold season? I think you already explained it, but it's just that I'm sharing it for somebody that was just kind of curious about it. Is the vaccine going to help the people during the winter time? Or because right now we're traveling or we're going through the summertime and it's most likely this is a summer season. I think that the question, if I could interpret it, they wanted to know with the vaccination, is it going to help to reduce the number or the rate of those that getting affected by the COVID-19? Have anything to say about that?
Yeah, thank you for that question. So definitely vaccination, all the evidence we have so far is that it is protective against all of these like different variants that we've been seeing even as COVID has been changing. So we have great reason to expect that you will be protected in the winter if you get vaccinated now. And definitely flu season, like you said, does happen in the winter. And we will see what that looks like this year. But by protecting yourself against COVID, that can help in terms of reducing burden on our hospitals. So even when we go into flu season, if a lot of people have been vaccinated against COVID, then those people won't need to, seek care at the hospital. And then that capacity will be available for anyone who does get the normal flu that we see every year.
Oh, thank you so much.
I wanted to add one thing, about it as well. So in April, we went through kind of a big rise in cases across many of our age groups. And one thing that we didn't see is an increase among older adults, 65 years and older, mainly because at that time they were the only group that was eligible for vaccinations. And the vaccine really did a lot to reduce the amount of COVID cases that we saw in the older age groups who were eligible for the vaccine. We're hoping to see similar things in the fall when we kind of expect cases to increase too because of the changes in the weather. But everything that we've seen so far kind of indicates that the vaccine is going to do a good job and be effective in, reducing the amount of COVID that we're going to see this fall.
Okay, thank you, Tigran. That's very, very clear from both of you. Thank you so much. I think that I will have my last question here. That is also.
Oh, can I ask a question, Fatima?
Sure. Go ahead.
Yeah. So thank you folks for being on here. I'm just curious. I think the last session that I was with, I I'd asked Celia a question about like resistance with like faith communities, and I'm just curious, like if you folks are still meeting resistance from faith communities, and like what's the action items or plan around trying to get more faith communities vaccinated, or kind of deconstructing those myths about what the vaccine does and whatnot.
Yeah, that's a really great question. Our communications team at Public Health Seattle and Kings County, and our community outreach teams are working with faith-based organizations to spread the word about vaccinations, and try to encourage groups to get vaccinated and try to meet their needs. We welcome any kind of community input or any requests for partnership as well, and we're happy to provide any information that we can to groups that want this information. Catherine also does a lot of outreach with the Native Hawaiian and Pacific Islander community, and could speak to some of the work that she's been doing around vaccinations.
Yeah, I was just going to add, thanks, Tigran, that in addition to those teams you mentioned, we have a couple different focus groups within King County, and I'm on the Asian American and Pacific Islander one. And we've been working on trying to have things like info sessions with different groups so that people can come and ask their questions directly. And we can try to help people make the best decision for themselves. So for example, last week we had one with some of our South Asian community members. That was an evening webinar with a community-based organization to answer questions, and we had language support so we could answer them in different languages for people. So definitely, if anyone listening or any of you have organizations that would like to host an event like that, please reach out to us and we'd be happy to work with you to have one.
Perfect, thank you.
Okay, Brendan, did you get the answer for your question? Brendan?
Coming.
Yeah, Brendan, do you have another question that we can wrap it up now? Do you have one more question to go? Since you're working with the Pacific Islanders community. Brendan? Okay. Well, thank you so much. I think you guys taking your time to provide all this information that there's a doubt, that sometimes the people think, what about this, what about that? But all this information that you share, that is very, very relevant, and it's really good, even some people are listening from outside of the state, but it's also nice because it's giving them, inspire them, and it's kind of giving them some leading information to know about what to expect, especially dealing, with the pandemic. And now it's all lifted here in the state of Washington, and we wanted to continue to stay safe. So the last thing that I could ask Kathleen Lau, since you're an epidemiologist, and also Tigran, what is something that you can advise our Pacific Islanders community while they're listening to the program? Some people come in late, but they will be able to pick it out, online. Just to continue to stay safe. Since the restriction is being lifted and limited outdoor are over, but what is something, that you can maybe feel that it's best advice during this time, since the restrictions are all being lifted and formally open right now in the state of Washington?
I'll say, some of the things that we can do to protect ourselves still apply. We can still continue to have gatherings outside. We can wear masks, we can social distance, and we can also get vaccinated, and that'll be a huge help for us. I think one of the happiest days for me throughout all of this, I got.
Yeah, this is a radio show. Okay. Okay. Thanks. Okay.
I got after I got my vaccination. You know, I visited my parents for the first time in a year and a half, and I can't tell you how happy it made me to like go out and like be able to hug them. So I think, you know, like getting vaccinated is such a kind of great thing for, you know, making sure that we can continue to be together, you know, like be with our loved ones who we haven't seen for so long, or like been able to like be around for such a long time. So I think that's kind of the one thing that if we're going to take away something from reopening is like, you know, one of the safest things we can do is, you know, get vaccinated so we can protect those around us.
Much Tigran, and we do greatly appreciate you and Catherine Lau. And I know we have a physician assistant that's just joining us, but we do appreciate and like what you're explaining. Mahu inga au pito kai nga to nga pa mo'y paswiki ke mo huhu ngao e ngai kaito. Very important for everybody to take the vaccine. Vaccination to protect yourself and protect others. Thank you so much, and we do appreciate, and we're looking forward to, you know, for some upcoming program in the future, maybe towards to the end of the summer. Then we'll see how it's taking us from here today. But again, thank you so much, Tigran. Thank you so much, Catherine, for joining us. Great information to share. We'll have the little song here. You know, it's Melodious Pacific Islands Breeze for both of you as you're ready to depart from us. But we have the physician assistant here. He's just joining us, you know, that's our part 2.
Thank you so much.
Thank you everyone that were with us, you know, on the part 1, that we have all the eviction prevention program. This is all talking about the rental assistance program. And if I hope that Mark Ellerbrook, I hope that Tigran, I hope that Mark ngahi fika ko ia mo tuunga ko ia. Okay, ko COVID tata ai King County, pa pe for Catherine Lau. Ko tahe e kautagata ko ia mo whakatotolo maha ki ko ia e COVID-19 mo tuunga ko ia tau ia i ahoni. Te ta et vene tau ki fasi ka ko tau patu tau ka fatahai mo Dr. King Langi ke fai atala no ke ngai tafak mo ilerei pa ko fefia foko sina no kui loto. Thank you everyone from the Pikawa for joining with us today, and also Pastor Noah from the Nigeria community. So we'll play this song here, and then also we'll continue on with part 2. Te tau kau whata mo Dr. King Langi. Tala no ai peka ngai mea ke tokoni ke mo ilerei. Pea ko sina fo ke no ki hen. Ko inga ko e ngā wea sina ko e toka ngai o e kau taurekereka.
Whanongo i he ea oe manutala aho Kua toe mawhinga lufani fo oe lato Nusila e folau i he waha mama o Seuke Oi seuke Si e kupele Pete ui ui pe La tai mauni no nute fe fe te te ke ngalo na ia fe te ui ui pe he ika ike ngalo si o tau api masina whainga ta ke mau si a fia si o fofonga Yamo oni leva ae lau ai folofola o ke mahulu hapi he maka koloa Makafala, hoko koe tuhulu te kohaka pasa Ofa aki e whaka ue ta mai ta engata Seuke, oi seuke Si e kupele, pete ui ui pe Te vita, la tai mauni no nute fe fe e te ke ngalo na ia fe te ui ui pe Seuke oi seuke Si e kupele pete ui ui pe
Maloi lele Dr. King Langi pa ko whawhiawhia whako ngā ka tātou e kawhataha. Ko King Langi ko e talo e kamata mau programa me he tau ko osi na mau kawhataha whakai. He ngai tala noa ki ha mea e tau koni ki ho tau kakai. Pea ko ia ko e aho ni te o atu pe a he taha ngai whehui ko ni ko osi a umai. Ko ngā e King Langi ko e tau whenai e tawhaaki i he tau nofo hange tau te whito ko tau nofo katonga ko ngā ko tau tā nofo katonga eni ki ngahi whakatotolo pia mo e ngahi whakatotolo matahotao e kau sainisi ko hana e mea oku ne wesia lahi ai ai sino ko e mea toko ni pe ko e tae mohe pe ko e loto mamahi ko e hana i ha mea te ke taranoa ki ai oku ne wesia lahi ai sino o e tangata malo Kataki e King Langi o unmute mai ho telefoni ko ke o mai ho computer.
Sai, wo ngate tamin?
Ia.
Ia mala bito. Mala bito e film hawinga ko ni ko e atau talano fo gai ki mo. Ngahi me would hang a sia I seen ko I overweight because obesity ai tau europei I he tau fonua ko sisi no ko ha me un hanga o sia lahi taha o overweight because obesity because sisi no ko me ia ko ia pesete valu mo fulu ko mau me to ni pe aqui pesete be mo fulu ke ta nima ko e to me ke me ia Ako mau mea toko ni ko mea mahui ngā taha ia. I te hanga tauhi kita ke te mo de rei, pe whinga i ke holo tu sino pe he. Ke sino o te lava o whawhepake i ke ngai mahaki o hao tu sino. Hange ko diabetes, hypertension, high cholesterol, gout, arthritis, autoimmune diseases. Ngahi mahaki ko ni uia kia kita whaingo fuang i he taimgo te overweight ai pu te obesity ai. Hange ko lau ko hai mea uku ne uesia lahi taha whahinga aparaparema ko ni kono hinga pe ko to onga mau mea to koni kakai. To onga mau mea to koni to taha to pe. Moni pe o kakai ni no pe. Kai ha mea. Kai lahi a ko sino pe au. Ko ki peseti si au pitoyo ko mea ko ya. Lahi taha pe anga ko fumatala nai ko peseti waru mo fulu ia o tupu be me mau mea to koni. Taka pau ta whenga ke tau hanga o. O whaiha mea ke to koni ke tau tō. Ton pe ke tau tō kānga au pito ke he. Whahinga mea to koni tau mau mea to koni miai. Pea mo tau hoko ke ai ko tau ngahi lifestyle. Ka koe mahu inga taha hange ko whamatala nei ke pesete wango fuu ia ka mau mea to koni. Ko wate tau whoko mau mea to koni me mau mea to koni e tau whangakui hange ko ena tau whamatala ke ai e mahu inga ngea pa toe aonga ngea ka te tau tō he tau whenga ke tau mulere ange. E whanua ne alpe tai mia mo. Tau nofa tau he whanua ka pau he kai ke te tokanga te mau i ki tai ai paraparema ta tau. Uinga he koe nau lifestyle nau tōrui ku tāke kina ia kakai ke nau tui sino ange. Mahina peka ti tau tōru hau koe na COVID-19. Ninga mea na lahi taha ai malolo ia kakai i Amerikani. Kono ngā peka koe kakai Amerikani ka kakai o nau. Fu overweight pa nau obese pa nau Kuna sino na kaki mo uile rei ko hinga mi aya na lahe ko mate i he COVID-19. Lahe anga te whanua. Ai uton peke mahina ngati tau tō kono hinga ai nga ko e ni ko hinga peko e tōnga standard American diet. Ai e kun hanga wesia o tau sino ke tau overweight, pa te wesia tau sino ke tau become more susceptible i ngahi chronic disease ko ni o kawa i pepe mo COVID-19. Ngahi chronic disease tau tano ke ai ko diabetes, hypertension, high cholesterol, ko autoimmune diseases, ko gout, ko rheumatoid arthritis, mo ngahi mahaki ko ni. Ngai mahaki o totonga tau tokanga pita ki ai ko ngai mahaki ni wisia lahi taha ai ka Amerika he tai nio bege cancer. Wei o totonga tau tokanga ki ai ngai tau kon fai ka tau sino. Pea tau mohe jefia abungbongia. Wei mohe o kau au pita ke he mea mahu inga lahi e tau mure rei. Ngai be tau ki equation na tau tano kei ki mua whatima ko the BEDS equation, BEDS equals 80%. I have got breakfast, exercise, diet, and sleep equals 80%. Pa mō mana tui, ko tāna ki whakātoa rewa, ko o kue tātou, ko whepōpō aki whawhāmi, ko good family support. With good family support, o kun hanga o sia tangata, moene tōnga mo ui ke te au, ke te mo udere ianga pe mo i whaoange. Taimko tau mo vete ai e whaamiri, o hake tau whamatawa ki mua pe koe whangi whanau, e taimu tā ngā whamawahe e whangi mokopuna me whangakui, ange koe whatapu kuson whai, ngā te wāwengi whangakui ia. Winga koe whainga bond koe ia ia mahu inga. Aia koe mea mahu inga e tau nofo whaamiri, pa tau nofo koe community, tau sio ke ngahi mea hoko he blue zone, ngai blue zone ai ko I mama ni ngai fei tu mahino mo ulele mo ufolo ai ko continentality pe taha o tausio Asia blue zone ko Amerika ko I fei tu ko Loma Linda California ai ko nofo I he kau afitu ko kakai afitu ko kakai tausio pe mi tonga kakai na mo me to ko na toria si abita kakami manu kum na mo me to ko ne vegetable ma fruits ma ngai me ko ya ai na ofi abita ngai me ko na hanga o fai o muy que ai mo fai nga lao na fuaki e mamunga kata ki pe ki mo to ko na fano mai ke fikumi ko fai ko mamunga na pamata na profita whole food plant based e tawal toto ai ko fahai na fai ke profit no se samit pa e tawal fa reva e fikumi na adopt le vai 7-day Adventist pana va ofi e pe nga I fitu taki 7-day Adventist mo ma time ko ni na ko ha me ko ta mini to se ta min Loma Linda California ko I feitu pe taha I o continente lá o mama ni Asia blue zone ai ko blue zone ka ki community na mo ui o ta te o na ke mo ui le o te na do luia pero lá he bit nga study sia America ta ni o ha we me he Loma Linda California me ka kai ko ni fu mo ui le o bit po ke na o fu la o va we dia na to ai ta pe ko Loma Linda California fica wa ke continente pe ai ko to ta pe taha peia a feitu he o continente te lalahi o Asia ko Amerika ai ko Loma Linda California hoko gai ko Okinawa Japan ko fonua pe ko ki motu pe Okinawa Japan hoko ki ai ko Ikaria Greece ko ki motu pe moia hoko gai ko Sardinia Italy ko ki motu pe moia mo Nagoya Costa Rica ko ki motu pe ko ki konga fonua ko ngai pe ki motu isolate na to pa ko na fonga mo ui ko na kapati tau da ki mo do ko na mo na mo itonga ya ko o mo hako ko ke historia tonga mo ui wa tonga I kamata anga na tau fe of family no for family pe tau sio ke anga social structure na tau tupu ai na mau no for peki kolo mono ki tangata uia ko mata pure pe ko pe mono ho weki pana tau mahino pe anga tu tau no foi tonga pe mau ka ko fainga no for mau pe he hanga promote good health ai ko tau sio ko tai mini no for family o hange ko ilo ko he kau tokata mata ta ko ni Amerikani na fe kumi na pe the most important contributory factor to good health is good family support ai mahin ga titau do good family support o ko me mahu inga taha ia o de fenga ke tau ke te mo ulelei ai ku kawai pesete val mo fu ma me to ko ni o ku ngahia he fae na tafu mata la be kai Fatima ke mo kai ko fae ko ngai ha to ke tai ke family sto pingi to yo mai vesta po mo fuchi mai pe ko ya manio ke tal ku mala ufi ngai fa le ia ma me to kon me fa na ki family pe ko tai mo ma me to ko ni ai frataha ka ui he ngai me nga o mai family frataha pe ia le ngai u hinga lai ke mo ui fo loa e time no for fun pe family e anga tau no fe fun one ke ko ilo ko dai mini e tau e anga go fe kumi pe a ko ma fe tu tak pe mo katam tu ta me Loma Linda mo ngai ka tu ta me Casa Hospital time na ke Hawaii ai no mahino pe ka ke ka ta mai na wa fa matala ko i na fa matala ia o ko ende fe ka waki mga influence na fa he tavalu fa no fulu fa pick up ia afitu o hange fo ko coffee mo tea mo mo Istapaka mo Inukawa ngai mea ko ia whakaiki asi beha to tapu hange ko te hata ni lag mai no peka ti tauto whakatau whiranela kausileri na nofo ko he ke koti ko a Nebuchadnezzar tau fi ko te na ma me to kon me ka no manu pe ose a he valu pe na fu mata ta bito na ata mai me ngai whakakaukau ngai whafuafua na whai whalao o i he wheitu koe na nau iai. Ai ko kausileria. Ka ke, ngai mea pe whau tau talanoa ki ai, tau toton peke tau manatui, i anga tau e ho tau ki whonua, na tau mahino mau peka ti tau tolu koe otua ko mea mahuinga ia. Pa koe ne tue tai mini koe science, mo religion, o ku ia ne whekau aki vlahi au pita ngai whekumi he tai mini, I loko ke tuunga koe o uilele koe tangata whakasosa iet, whakawhamiri mo e anga nau whitutaki wheitu mo e hange koe ngahi koloni kanu tau talano kia koe ngahi blue zones. Te mula peo Google blue zones pan museo kia ke blue zone nima I mamani katoa pa koe nau tonga mo uia pe aku na wo lotu ko kakai ko niu na wahe ia taimi na wo ai lotu pe la de na fa family fa ko o ngau fa ta pa na ma de kon fa ta o ngau fa ta hange haki kolo haki fo family e feitu go na ai ai ko ngai be ko niu fe kumi ka lotu na fe kumi ka ka ta na ilo ta ko ta haime ngai mea mahuinga ko nofo family ko ni hanga whaloloa e muhuia tangata pa whamui whololoa.
Angi ko ngai nofo family. Te tuanga mai ki whangamari ko ni ki a Sina aloi tafuna Packer ko sis also one of the senior community leader. O malo wiahane mea ke tanaki pe ko ne mea fehui e mea e tokoni ke toi whakalakalaka ngai mo whatup mo ulerei ke kau taure ke reka. Ko ia Sina?
Ia. Pamalo atu Fatima e tuku mai whainga maari e pa ko atu ai ofa ki he toke tā, tamato e tā, king lang. Ko kau he kau ngata maki e volunteer ki o tau kau taure ke reka ko inisia toni. Pea o atu ai ofa me kau taure ke reka, nau talanoa peka nau tolu I he taimi na tau talanoa I whamui ho hama I he mea he tau talanoa. Banai ai sinia ai to leka taha o kune talamai kune ilo lele koe ke talatu hono ofa ke te koe ko hono ingoa ko tu ipu koloni tu ipu lotu ko ia o ko tamai eloni ke talatu hono ofa ke a koe o kune ilo lele koe pe o ke ilo lele ai ko ia ko whenga peke whaka watu ai talapopo aki mea loni pea o ko mo whamaoni I au pito I o wakai koni ho lea whekau aki ki Loma Linda pea mo Okinawa, Japan. Nau I he ongo wheitu ko ia pea koe mo oni au pito lau ai kautou leka koni Okinawa, Japan. Mo ui lele au pito o te kia hange pe ko tonga I ku wakai nau tolu nau saia he lue he hala. O nau lue toko lahi kautou leka ku lue ko nau ko na tahe na whamau sino nau lue he hala. Pea ko Loma Linda o kai ko haki ko city ko ni o whaafo ofa kaka nau osi I he city ko ni Loma Linda California. Ko ia o ko whamoni o whamatala mo whaaflea ki he kawaki ki o city no ni. Ka kuia e ko kataki pe o mo whanau mai pe Iyo. Koe kautou leka ko ni sia toni o na mo ilele au pito. Pana mui ki o advice fra mui ke ai pe hanau ki mea kai tonga pe ka ua fu to tua kai ki mahalo pa ku kawi he mau he tufa na po mea kai po e pe ki fo I hopa pe ko fo sai ne mata ka ko na fia la ke foi ta na mau ai na u ka papulu ko hia pe ka sapat la mai me sapat fae na fu fia pito ka ko taimini foki ko whakango fua lahi ke nau ka matalewa ke nau socialize mo ya ko foi mahalo ko foi ke ne faki me ko ri ke taimini o ku lahi fa fia mo u party mo u hange ka graduation pok si lahi ka to le ka na o fia ai ya ko foi ya nau kai ma upe I he u party ko ni ka ko tui mahalo ko balance pe het nau ko lahi nau ko lahi nau fia mo si ko nau fanga friends ko ia o ko loto pe ke ha wa kai ki ai pe ku balance pe nau kai pe he o pe ke party nau kai pe nau ta lu ngai pe fia ai pe pa nau foki fia ko tui mahalo ko ta ha ia ngai fai to whakatonga ki nau to ki nau mentor o nau ke pe nau fia malo
thank you tala ke pe King Langi ko fa malo te ngai fa matal inga malo apito sina vahe lele ko manatu ko fanonga tu ko to fa manatu mai ai no fo fata ai family ko me e kul anga hake ai mo fa fia he ai ko ngawe fa sina fa ko toni mo ai fanki fate fanki polo kalama e ka to reka pe ko tu leva mahalo e to koni lahi apito ai ngai vahe ko ni King Lang ko nga ko time ko fiso fa ke ka to reka he wiki ko to ape o na fia pa te ai me mau ki lancho amana ke fra ko fa laite ko ni fa fe yat ki motolo ke mo me amai ke tau ka frata pe ko ya King Lang aya mahu inga ko ka frata e family pa mo ka frata fa fia mo ya o tana ke te pe ki ai mo me to kon mo lele kata ke o unmute mai King Lang o te pe ke ongo mai
unmute Fefe wong atu
ia ongo lele mai
okay malo bit ko ai ko fe ui ko feohi a ka vai
ia
ko ngahi feohi ko ni ko ngahi feohi mau inga pito o ka ui he tanaki ke good family support
ko ia sina
o we nga tata de fito ke ka kai tonga na fe ilo ngaki ki na tolu fe ilo ngaki ngai family pa ngai me ko ni fu mau inga pito hanga ai mo ui le mo tauhi ke mo ui le fu loa pe tolonga na mo ui he ngahi frataha pehenyo fai hange ko tafu mata nai wa oi pe ke he ki frataha he lotu to ta he wiki pe tu oa frataha fra family frataha faka fonua frataha faka komiti mo ngai ke feohi pe he ngai feohi kaulele apito ke mo udele whakakatoa tangata mo se fine I he tainu nau feohi pehe ai tau sio ki tonga koe ngai feohi whakafofa tampok tau whaamupe hoka tupe tau ki whanua ngai feohi pehe lava ke ma e feofofa ni ma whatutu anga mo uia kakai whaka au pe ke whakakolo whanua lava ke nau toe mo I folong ba mo le yang anga fotutu na mo ui pe nau lava ke nau fetutaki pe nau tau hingahi mea to tonu ko ia ke nau mo le to mo soroa o ke whanau mai pe Fatima Lose o whanau mai pe ke kure atu
ia ongo lele
okay sai aia ko anga ia ko mahu inga feohi ko na ko fa ia pe ngai pokalama mo fai henai o mo feitu ngai me to ton ke po pe a formanatu ke ka kai ko ngai feohi ko na ngai feohi le ia ko na mo le ngai ko me abe ke o pe fulahi kai ka papulu ma pe he time ko to pe ai pe ki la ilu ki ki lupulu ka ua kai ma me tokoni kakanu i manu ata kai ke nga i tau tana fu ko ni i kai ke pe tapu opita ke te fai kai kakanu i manu ma me tokoni me kakanu i manu ngai pe tau ustala no be kai ki mo ko tau ma me tokoni sparingly ai ko ma me tokoni e fe ma ko ke mo le tangata o kai ki ma me tokoni kakanu i manu fu la kai fe unga pe lah yang mau me tukon me whole food plant based ai ko tau me kai fatonga ko talo kumala ufi manioke mei kape mo la ilu la ipele mo ngahi te mata o ni ngahi me ka to ko ya pe ai haki lo ya ka ki fo iniu pa inu ki ho vai was fa of apito ya ko ha me ya ko me le apito pa mo le famo le ke sino ia nga tau i ke mo le mandu ko mohe to ton ke mohe ko wal tau ta no be ko breakfast exercise diet mo sleep mana tui ko ma me to kon pong i ma inga apito ko ki formulation ki lu ta kai holo time ko to pe ki ngau o fu ta ko to o nepe a ho pasika pa to mohe po uri kai ke sai sang pe ke tai me ho tu sai pe ka pa ki malolo i ho pe ta pe o ka tu pe lu ta kai holo ta kai holo fai te ki ngowe fai te ki ngawe fare wo i ta kai pe ho tau sino ko me ko hinga exercise ko ndo hinga ke wo i ma be tau sino ke ngawe maso porque tam ko ngawe ko maso o te mo ile yang pa te le yang ma ange kala wa ke fetu taki ko le toto o tam ko tau to ma wai o ki ma mari e fo ai alo toto ke ngai fetu ko ni pa te la ya e tau puke mo tau mahaki mo felanga aki ko pa de tau ngau ai ko ngau ko formação pe ko formação ko ngau pe sino ngau maso pe ko time ko ngau maso hoko tanga hui le wa fafanga ai sino i time ko tau ngau e mo tau formação ai pe time ko kai ke tau ngau pe tau formação o ku tipo si le wa ngai chemical ke joints ne pa tu felanga aki tau ilo pe time ta tau kai ke tau we tau sino pa time tau tua ki fai ngata ke ngau tau ngai joints ko tau kai ke tau ngau fulo na ta uisia ta ko time de tau ki ngau ma pe ai o ku ia mo ulele pe te hanga facilitate the circulation facilitate ngahi nutrients ke hau ke joints he time ko ngau e tau ngau ke formação mana tu ko ngahi ho tanga hui nourish ai ho tanga hui he time tau ngau e mo ta formação ai ke time ko ke tau ngau e mo ta formação o ku kai ke nourishment au ko tau ho tanga hui ai mahino ia ko me ai o hanga ka ko ta o forma mafai mai formulation fra aho ko ki lu o algi tonga sio ke hala ko na vuna e ku sio ke kakai tonga una lu e hala vuna au ke tawa poli ko sio na ke fai pe lu pa ko pongi ko sio to asimo mo kakai una lu he pongi ai me le ia formation ke lu pe ko lo pe ko fangai ngaki kolom fangi motu ko pe mata ta ke lu ai pe ai pe ngai ngo wanga ke lu ki ta lu mai kolo ngai ko lu ko ta hai formação le ka pa ke il formação ke fai ko foi lu ko me le ta mo ngau pe to sino de famau te ki ngā tō tai api mo tō a kau mo tō matalai a kau mo alu ngou me ngahi mea pehe ua pea ke te fuhela ia lahi kai ai fe unga pehe ko ngahi ngau e ko tau peu te whai o ku kau ia ke tānaki ke te whamaloisino pe mo te mo lelei pe tai mo kai ki te ngau e ai mo te tokoto ma upe ai u kai ko me ai ke te whamu lelei ko e tokoto he tai mo te mohe ai po uri tai meu to ton ke te malolo ai pe mana tui ko e mohe koe he hoa e wha ki mua pa te koka tahawa midnight ngahi hoa mahu inga apitoia ki e mohe i midnight ki e aho ngai mea atamai ngai process atamai kulele i he taimi ko o ku te mohe e fiafia ai ko mohe e fiafia mo e a pongi a o ku kau i he mea mahu inga to ton te tau maratua i he taimi tau mohe ai e tau alo mohe e fiafia pa tau a pongi a
Taki pe e kinglangi ko e whehu i ene maha koe whanongo pe ki o whamatala koe ni. O pe e toko taha koe ni ke ka tak whamore more mo a ko au o ko alma pe o mamakawa. Pea o ku iai naha mau o e ai ma o kawatonga ki hok to'otonga he tala mai foki ko e kawatonga. O ku hange peha te inu hangahi vai pala pa tokoni pehe ko inga ko e hak mina tula. Ka ko vai kawa wha toki alu foki ki api he tolu pe ko i wapong pongi.
Ia, mara pite whehu ko ni ka whehu i o kai ka whehu i enu hau mau pe ki he mamakawa. Ko e me pe mahina ka ti tau tolu ko e kawa ko e mea ia tene lava whakakonahe tangata. Paku ilo pehe kau tangata nau maukawa. Te nau lava peo maukawa au ke nau kona efu lue ki a piu ke le lava lue. Ko e affecte ia atamai. O ki mea si pe e sai pe ka kono tou whai whahinga unganga ko ia e kai ke lele ia ke mo ui whoroa mo ui lele. Ko e whema sino e ke ma lolo. E kai ke hanga uia o pehe sai ala tō tāka nā whaikawa o ke tolu i kai. Pako whaikawa tō taha e wike. O e kaure rei ko e whiohi koe mo e kaunga mea mo e whāmbiri he whaikawa.
Ko e tohi mai peko tala mai o ko ilo i o nau ngahi vitamini pia mei he kawa. Ka koe hānai ka pau ngahi ai vitamini mei he kawa tonga. Ka koe hānai ai lauia koe ni oku mau e ia sino.
Sai. Mo ne pite whehui koe ni te tau whamatala ke ngai vitamini. Ka pate tau tō e vitamini ko toa pe. E where a vitamini e ngai mea kai au mi kai ke lele ke tau mau mea toko ni mi ai. Koe pia koe mau mea toko ni ke hawhahinga mea ulelei ka alo furahi e te kau kovia ka tu sinoata. Pau peke te ai whakafua, pea hange koe ta whumatala ki moa e whatima koe whole food plant-based, kau iha mea lelei taha, aia koe tau mea tokoni he mea tokoni whatonga. Koe kawa aia koe mea iha ta whaaki, koe ke kau iha he mea tokoni. Koe kawa aia koe ki whiohia ngai pea, o koe no benefit o mea ko toa pe ia he hau me plants. Kau mō mana tui, koe vai o te inu ai, o ku te whia mau ke te mo ui. Pakapate te inu fulahe vai, you become metabolically alkalotic, pea kau kovia ka tu sino ai e fuinu lahi koe vai. Ka koe vai o sai. Ai ko tau pehe, o ku sai e kawa, koe ki mea si pe ki hanga whaka unganga whafonua, koe ngai mea ia ko pehe, sai pe ko no te toko ke alu ma pe he fiafi mo e fiafi o fai ka wa ko me ia o gohanga popoi ko me ko ke feo hi fa family mo fo hi fa kaunga mea ngai mea lele ia ko man is a socialized being Porque taimi ku fio pe he ai mo ki po ta no ka o pe fu lo ne taimi pe donde va che foki apio malo lo. Perché se no ia capaz che tenga anche taimi da tonu che taimi le che ma wa ne malo lo o perché che se no ia ka kita perché fe taimi ne to ton che o ange e te hoko kita ko te ki ma ki ange kai ke ngahi tau hi to ton ke ta ka ke no mohe na tau ta no gai perché te mohe ho wa va ba ke te to nga e te diet pe to nga mi te ki formula sino pe to nga ki te ma me to koni pong pong taim da tau pe mo manatu ke ki au kai to ta hai ke ko me a fomu le ia tau sio pe ke ngahi au kai ka halot cristiane me le ia pito ia to ta hai wiki te tu oa fa pito fa ta ia pa mo lo tu ka le ia pito ke ara mo le mo me te tu ki ai pe ka le ia hange ko ta fo matala ne nai ko ngahi ulunga fa tonga mo tu o ki ta to ton ke ta honga pusiaki ngahi patau popo ke ngai ulunga ko ngai unga le ke no foi ta ha ko pe maintain identity o tangata mo fine tonga ko to pe fanuani ko ngai ki popo ta fa ko ya
Mala opito sina ko tui pe to yai pe ho yai pe fehu ke tanaki mai ko nga ko e kau tau lekeleka pe aku ko fin te fa mole pe ka ko fin e ki kon asina ta wal ngofulu pe ako tui pe ko ngai me ako ni to ko ni pe ko seo ki ai anu ma nge pe pule lulu o ku fia ma ne fia alango feo hi mo se ta kai holo ki nau to ka volunteer mo ki nau to lo nau asiang ave nau pu me kai ai ako hange ko lau o fa fia ai me ako feo hi ai ako hanai ha o fale ko nga ko no te checks mai to tai ko ni tala mai o kai ki tangata e ke ta walu no i mau mama kava ka ko ni o ke sai pe ya ko e fere vai me ate muy ki ai ko ya ko ko fine e kasina
kata ki fate malo mai ki fenga mari ko ni ko ata le vai ki te hui o ko ta ko fine iki ko to kanga tu i vai o ku nei lo ho mari a lo se tala te ne ofa ko ia ko ki fe o ia ko tu mahalo o ku to lahi ai ko le aten pe ko ku se aten fa fo nga i ka to le ka o ku mahalo ha fe pe lahi yang ya na to o ku fe to ake mohe ko fine e ki a ku ya ka mohe ya he taha po taha wa e a be he time tatau pe maha pe a he ni ma pe a he time tatau pe ka mahalo ka thoa pe talamai ne ho pe tolo ne mohe anaia pe ko ho mahalo ke o tai taha ka pa o mohe o ova he ho ai ono
ko ya
ko ai leva ne ki fa ya ka o to kon ke ne mohe pe ko fa no na fa tala no pe mo to le kele ka pe na fitala no a ki pe o hua a ta o se mai he to le kele ka ko na ka ke lava ya mo he ta ne a he to lu a neu te ke to lava ya mo ka ku fi high spirit pe ya he o na ke fi be to mo tala no mo se ka ko e fa tai mi lahi o ku hange ko se mai ko ni ke ranga na mo he o very unstable he tai min mahal pe ko fi pe ko lahi na worry ke he to mahaki pa ko loto ke se atu mahalo ke pesete hi banoa ai ka to le ke ko na vaccinated ulaki mo ewa ai aku we are good I have
le abito
ia
le abito ko mo ne abite ngahi tanaki ko di ko manatu be fo ko tau sino fe mo tau sino ia hange ko ki fo equation na di mo breakfast exercise diet mo sleep pe ngai me ko fe mo sino ia ka ba ko hata fe mo le ba mo I fo loa ko ngahi area to ton ke tau ki fa to nga ia ke ai breakfast, exercise, diet, pa mo sleep. Ko taha ko tope o gu mau me to kon ni pongi he time ko tope tanak mai ta ang fu ke mo ui. Ko exercise no tonu e tau ngau he tau sino exercise ke time ko tau exercise ai ngai ko formatawa ne nai ko time gu nourish he sino joints e time ko ngau ai. O gwe ba ngahi ibi gu danga o mai nutrients ke ngahi hokotanga hui ke famu lele ia ai ko taha ku formalosi no ko taha mu lele ia ka ko kala va to ki lele yang lele to taingo ko ai te exercise mama ri to ia pa vereva ni tana ke anga ko oli se kala va to mama ai ko mina me ku sa ko information no ko mohe ia ko ton ke mohe tangata ia hua val Pagabau ke ma he pong po he po uri to ton ke handi ki nepian he aho haki malo lo he lo tonga aho ko taimi le ta ke nep he aho ba ta wa ke e fiafi le taimi to ni fa ki nepia ki mo to ko no ke lava ko ba hua valu pa ko he kai ke tau to ma va he ta to me hua valu he ko ngahi ako ko he taimi ni ko ke nga sleep hygiene mo sleep studies o kai ha fahinga ako ia no hanga o fama mafa mai ke si yang mo he ho agalo ikai tau wali si valu pa tau hia ko ho ko vai ko o aho ai ko vai tolu etaha ai ko ho valu ke mohe ho valu ke ngau ai ko te formation ngau ho valu le ke family ai ko pe americani ka tu ta americani ta mini most important contributory factor to good health is good family support ai we mahu inga o fainga o fa family mo fo family e mo i fo mo lele ko o ton pe ke tau hanga ai pe ke mahino ke kisi kainga ta ko filia ko me fo tui ka ko ngahi mo ni ko ha ko me ngahi ako fa to ta me ton pe ta uilo ke ko ka se ni ia ka pa na uilo ke na mui pa na fenga ke ka ko ka se ni ia o na uilo pe na to luia ka we pe ngahi tai me ko ke na mui ke o fa fo tui pe pa ta kai ke ta ho fa malo ia ta ka ko ai ta po ka la ma to wa te fa hinga po le ta ko ta ka kai i he taurea winga ke tau fe mai no aki pe tu pe na do ke na fili pe ko ha ngai fili na fa he ko me ko ko conseni si ko o mai ngai me on ko to pe ke to ta ko to pe te tau fi pe ai mana tu ko ngai me ko to no ta na ki ko le me ko to pe the most important contributory factor to good health is good family support ai ko ngai fe po fa family ko ngai me to ton ke tau hanga po i he ngahi api ko toa pe he tau ngahi family i amerikani ka tato de fito ke he ngahi fe pe whonua i maamani o au pe whoki tonga he tonga tau hanga o whakamahu i ngahi iloko ia ka tau iloko e tau e tau tupu i tonga ma ngahi whonga pe he a upe ke fe popo ake ki kaunga api mo ki kaunga api to koni aki ngai mea pe ko ngai mea lele ia ke mo lele pa mo i folo ka nga be ki lave ke ngai fe tu ta gonu ta fai ke mo lele ko mea mo inga api to ia ke ta uilo ki ai pe ta fenga ke ko ngai mea famu lele ko ke sino mana tu ko mau me to koni ko tahai ha me ma winga taha pe ko ha me de mau me to kon me ai pe se de val mo fulu mo lele ko bi ai ta foki ke le ko na Hippocrates let thy food be thy medicine let thy medicine be thy food ko me ko ya wa ke tai mini pe ta usio re ka nga no family pa ko haire va to ta hai family o doton ke hoko ia ko toka ta ko fai e ko un fai ko kuki ko me akai pa o shopping mai o kuki mai o mai me akai to ton ke mau me to kon me ai ai family ke na mulele kono ko basic idea ia tau no gai ko mea mau inga ke tau ilo ngahi mea ko ni ko fae tokanga ke mea kai ni whanau ai ke na mohe taim to ton ai me na ki po kalama ke na wako tau ilo pe ngai family ko tu pulaki ba whakalaka ki mo ko ngai tau sio ke tau mo
Kinglangi ko kata ke pe ko ki fehu I pene ko text mai ko hanai ha o whakakau wha more pe ko ka whekau aken mo me a tokoni ka pau ko te follow hangai foi akau o kune mau I nai hoto system mi hoto sino ka pau lahi te follow hangai foi akau ngai ko ngai foi akau suka pe ko ngai foi akau kau te pe ngai foi akau toto maalunga o kune mau I nai ai o kani hoto sino pe ku tokoni ke ne malu I kita me mahaki ko ya pe
ko tari ai ko ngafi akau ko ya ko me ko Amerika o ai ko kau tu ta ko ke mai na license pa mai na DEA o na lava o prescribe na lava famoni ki lai pe pa ke ke pharmacy o lava pick up ngafi akau ko ya ko ngafi akau de lei pe ia o mai ke sino ko no hinga o guiai uhinga o kwata fi akau ko ya na sivio ke toto maalunga Pega tota malunga ko ibe ko nga he mafu teke hori se kalava. Ko ne alko fu malunga ko me po pare ma ko pa kalava. Te kono wa ko clock. Ai maka toto he ihe me. Ai o toton ke holoki ki lalu. Ilo pe kala sin ni ko tot malunga. Langa manava ulu ko hinga ko kalava ko nga foi pula. Pupula te mo pa ko ma. Ta ko mafu. Ai ko ngai mea ko ton holoki rewa ki lalo vai ta kai kai mate tanga ta ai ko fehu ko na ko prescription drugs o ton ki fehu mo to ta no moia pa ko ngai mea ko te lava pe fai pe ko api the most important vital signs here ko blood pressure pa ko blood pressure ko te lava pe ta algo ki pharmacy o mai mea de ki Omron blood pressure monitor Monita pe kita api bet fidu take te to ta laki ai. Monita moto weight, monita moto oxygen oximetry, O2 saturation. O mai mo ki mita fa ho pe ki foi tu ne tala mai lewa ai peseti ko oxygen ko to. Ko ngai ne ko ya te la pita fai api. I api. Paska bet te kita re vari pot ke te to ta. Ka hange ko fe hui ko ngai foi akau prescription ko hinga mea ku prescribe ai ko hinga he ku alu ke to ta te hanga to ta fai ni whakafuafua tau te tonpe ke to foki ki ai ke ne to fai ha whakafuafua ke furihi o te mope ke to ta o mai ki foi akau pa te lere ke ko mea ku hanga to ta o te pe foi akau ke lere mai na tolu tu ko ke he ka pau no si ilo lere to nga ko mo i pa ne to ka te ki foi akau ke te refill ala ka mai na tolu ke he time ta tau pe ke time ko ke furihi ko o ma ne to ko ni holo mo pauni te ke sioreva ko blood pressure algilalo ta reva ko to ta ko blood pressure na algilalo ta reva hanga to ta te ke lango ofisi ke no re-evaluate pa holoki o foi akau to malunga ki lalo ta tau pe mo suka ma himia ko suka to malunga hai ko high cholesterol ko ngai chronic disease ka to ko ya os provenia lava noa pe I he tau he mau me tokon to tonu ke ne holoki ki lalo o to sa ya he e mau me tokoni kai ke ko ngai me to ton ke tau tokanga ki ai I he tau wene ngahi prescription drugs ne ka to ta sa abito pe ia ka to ton pe ke mo fitu ta ki mo to ta ke ilo ho to ta ke mui ai foi akau ko ne o mai pe te hanga tala ki ai ko blood pressure ko holo ki lalo apito pe unga ko ma me to ko nim ho lifestyle pe te ko ha ene whakaukau ki ai ka to la he bito ka patient na ko solo to apito blood pressure medicine to mo fe akau suka ka holo ki lalo sino pe na mo ule le mo fo fa pita pe ia ko hange ko fangi fa ka vitamin mo me te ala fa ka fa ko me ko ia ko fa te ria pe ia to ta ko ia ka ngai vitamin ka pa u te ma me to ko me kai tonga pe ki te fe ma ke te au ki ta ma vitamin tu ka pe ka pa te sivi toto pa te elo ki hole vitamin la lo ngai nutrients ko ya
Oh, malo pe to ta ma ko ki fe hui fa o si pe ni to pe ta ki mini si pe o si ko ya hange pe ko me ko na ko lave kai ko to ta hai ni ko ki to mai pe ko ha nai ha o fare i oksai ke ngawe a ke ngai vitamini ke to ko ni ke oksino pe ko kai pe ngai me akai o natula hange ko mori o ma fo ke vitamin C hange ko fish oil pe ko kai pe ngai me to ko ni ko ma me ai fish oil ko fe ya naua o kusai. Mao.
Mo ne pita fe ko ni te tari hanga tono pe ko me le ta pe ko ma pe to ko fish oil me ika. Pia ma me to ko ni ngai vitamins me ngai fe ka o le. Kai he tai ta tau pe wa klasi ni wa ki na si ma me to ko ni ko pa na supplement. O la he pita ka to ta na supplement na to le ngai me ko ya. Ka koene tu e taimi ni ka pau te mau me tokoni me a kai whatonga o ku highly likely ke te toi whi mau ki te ngai vitamin ke ke toi tā naki mai. Lolo tonga ku te mau me tokoni le lei pe pe te me talo ku mala uwhi mana tu ko u mea koe ni ko whole food plant based ko e where a vitamin mo minerals mo ngahi mea wha mo ule lei ke si no. Ia ngai mea to kon ko ni. Apa te ta mau me to kon me mea kai tonga mo ngai mea ko tu tau ta no ki ai. E kau re apito ia. Pe kai ke to fe mau ke ta nga to supplement a vitamin. Tu ke pe ka pa nga to ta talat. Ke hanga supplement a vitamin ko hinga pasi. I o sivi to ki holo vitamin ki lalo. E lalo ke fra ko e mea ko ia. Ka ge kai milahi. O kai ki ke fie mau ko ia o ka pau ke mau me to koni lele i time to tonu pe ku kai ke ha me o ku mau i ho ua i time hanga ko fata posa no fai e time ko mau me to koni ku ifo pe me kai pe ku lai se unga pe to ton pe ke muy pe ai fai o ki formation no ma diga breakfast exercise diet mo sleep 80% of your good health because 20% level me good family support for the high mai o kaui ke mo le ta tangata fa ta mo le mo o val mo ngai me pe ngai me ai ma we mo fio fa family wa fonu ko ngai me le ia nga tau fitu taki mo le
fa malo atu apito king langi ko ia ko hangi ko lau ka sina ni nai ko to tahai ni ko ni toi mai Karesi taha o whanau, ta mai ko e taha ia o kau client, ko e kau patient ia a ana he taimina i soleiki ai. Pea ko ia whawhiawhia whoki. Ko tui ko e tawa o main ke whaasinga polo kalama, ko ngai whamatala le rei, pea mo mahu i ngai ni o ku wahe mai. Tau whiawhia katoa e whanong ka ngai mea, ke tō koni ki he tau nofo whakaaho, ki he mo uilelei. Pea ko ia i sinau te iaha o ki i whaosi, ko ni ko tawa o mai ke whaasinga tau polo kalama ki o e toe minite tolu ke walu wha malo a tēni ko e ni longo tā kapi malo o pito e kau mai ke tau polo kalama aho ni pe whakaari si paswa mula
lata ke o ia tak taking lai o ku ia e Facebook e kau senior ko e First Tongan Senior Association ka pau ai ha taimi ka ta ko visit ha ke ai mau Facebook ka asia e tokolahi ai kau to le kereka ke ko fa upload pe uta he tai me na fie ai i he tai me na fa ya to mahaki COVID during pandemic o ko lo to ma be ke pose uta na fie mo na ko mo na ko e kawi ai ko tui mahalo ko e fai to lele ia kana to mentally ke na fia mau pe pa ko ia ko loto pe ke u se na uta te ke vakai ha ke pe mahalo te ke iloi pe ku ia lon ia ka ko tala no pe tala ni tu pulo tu one tala mai o ku tala mai ke ile tai me ku ho ka ya ai to ke ta ke hu wa to ke matala no io ko ta ta ke ma wa lo ni ya ma na si ke a o ngawe
Kaya.
ko ya o te ma o fa mo
Tapi
ma lo
kalau ni kau ke best friend hiu ke si tak uvalu ke tak ngofulu ma tau mau be
Oh,
i
yeah.
faru fa
iya malo o fa tu thank you Fatima for sharing
malo
Malo
iya
apito sina, malo apito tau polo kalama hoko e o atu lewa skero ko inga ke te wa ke kau tau reke re kapa o kusai ke na hu mai ke na fia fia. Aia ko e wike huapa mo e wike hono fa ko ia ko a kinglangi e.
malai
Wike wapa mo e wike
Fatima.
hono fa mo e wike fahiri wike. Te tau kau fa tahai mo kinglangi. Ka ko fa malo lahi heni i ngai fa matala aonga pe o tokoni. E ko i ngā koe ngahi tau pikin, e ko ku, pe koe ngahi ka vei ngai o ku mahu i ngā au pito, koe whe la lawe i whoki mo e tau mo ui whaka aho. E ka pau, he kai ke te mo ui lelei, o ku i kai ke ifo e te nofo i he māmani koe ni, koe ngahi te whe ao mo ngahi whenga taa whakai sino. Ka kou tui pe. Whamalo lahi e ni Kinglang, whamalo atu i he tuku ho taimi, ka ke tokoni au pito, pa fia au pito e, ka i ngā wā me kalasi o ku nau hū mai me he ngai whitu ke pe aku live foki ai polo kalamani i he YouTube. Koe ni ko mao lewa ai tala pe me he ko vana ko ia o Washingtoni. Koe ni ko to o lewa ai whakataptapui, kai ke toi whai e social distancing, pe koe limited outdoor over ai e koe whakangata, pe koe ngai mea pe ia o ku whamanatu mai, koe ni ko whakaata state koe ni, Washingtoni, taha ni state hono whai Amerikani, ko nau to o rewa ai ngahi whakataptapui i he whonuani. Pea ko ia ki moa ke tau osi, o ko toi ate pe mai ki whanongonongo ko ni, na e kore mai e tō tako ni. E si o si whātui pulotu, ko e ngā koe Kingdom 4, Kingdom 4, amana ke te waki, ai whai ki i whakataha pea, whai pe mo ki i whenga, ko e hāpeha o ki tokoni. I he aho tō taha ko i o siulai, ko e tōna ki wha osia o e mahina katu, e koa pongpongia. Aho tō taha ko i o siulai. Whahoko pe he ap no whaanga ko ia o sio sifa tui pulotu, pe whoki kia lesieri helu tui pulotu, ka ko e kakaifo kia o e mahenga foa, pe ko e kau vai foa. O kui kai ko foa ata tape, ka wa whare loa, loto foa, fotua, pe mo whangare ounga. Pe au kai rewa ngai toko ni heni ke whai ki ai. Pe a ko ia whawhi at ki motolu ke tuku ho mo taimi ka mo te wat ki ai. Te whamana tatu heni, mo manatu iange o whai tau mental health support training. Aho ua mai aho atolu me he hiwa pongpong ke tātou noa, ki whai hoa e ua mo e konga. Pea koe atua pre lulu, pea mo e aho whalaite. O kai ne whelala ave i ke tokoni lahi au pito, ki mo uile rei ai atamai, whenga i ke whakahawhi hani ihi o nau ngawe ake whaito o kona tapu, pea i kai ke ngatai. E toi mau pe moho o ki i certificate, ke i lo i ai o ku ke te ke kalasko i ni. Kono whakaluku fua, koe me ale rei e nuk tau ngawe ake, koe ngai polka maina e kaunti, nau whia tokoni ke tau community. Siulai aho wa watolu, mo whetu taki mai pe. Ke telefoni koe wano aono, tono anima, valua ua. Fa malo ato e peheni, malo apito e tau kau he whiawhini, pea malo apito Kinglangi, pa pe foki ki he taki koe ai kau sinia, malo apito sina e ngawe lahi, pa mono tonga nga ea te kau tau reke reka, pea lava pe ki tau tala, koe mea mo ule rei ai tine e ki, pea ku iai whak mau anti ko le seri helu tui pulotu, ne mo ule rei apito tau le rei moia. Ko iai, hange koe whare i koe iai toke tā, mo mau mea tokoni me nā tula, whakasisi e kai e ngahi mea tokoni ko ia oku i kai ke mo ule rei, pako ui koe processed food, he ko e ngā tene holoki ai pe ho sino ki lalo. Tō whakawhia toi peheni, o amana ke whakahoko mo e ki lunch e koutou reke reka i he pika wā, pako Pacific Islanders Community Association, i he turiki ko ia e halahiva, 9th Avenue, pea mo e tolu ono. Aia o ki ai ko ni a toka malu. Kamata pe ake nau ki pinko me nau wheo i he hofulu. Pea hoko te peke mak mea toko ni i he tahaua. Pea whakawhi i atu kai ngatonga ka mou e vange ki tau kau whakataha. So, tawa mai ki he whakaosinga koe tau prokalama whakamalo lahi atu e ni ka ki mou tolu kotoa na tau kau whakataha me kamata ngā mai ki he osi. Kon whamore more at ka pana ato no. Thank you everybody that joined with us. Pacific Islanders broadcast. And also our radio engineer, Neta Tua Tapelava. Ta e tai pene tau whai whasko ni, pia tau whaose kai pia. Mo me a.
Hello, welcome to Bamboo Fiji Bazaar. We are here to help. Largest collection of Indonesian and Polynesian and Micronesian community. So you're welcome in anytime. We are open 7 days a week from 10 o'clock till 7 o'clock, and Sunday is 10 to 4. So all of our leaders are welcome. Indian, Pakistanis, Polynesian, Micronesian. We have all the community stuff right under one roof. Thank you.
Ko e whamarata tai peheni, ko e taha e kau sponsorship ko ia ki e tau prokalama, la vai o tuku atu, pea me he Fiji Market. Lahi o pito ngai mea tokoni lelei, ko toki tu uta mai, mui nau ngai uta mea kai pa me he Pasifiki. Pea ko e whawhi e tai peki mō tolu, ke mō mea hake, o mauha mō ngai mea tokoni, a o ke ngai fruit cake, na e toki tu uta mai. Pea pehe whoki ki he liko sio, ka paurewa o kia taimi, ke o ngoi puputu upe, kia ha mea whaingata ia ai, pe tukua ki i hala koe. Pe tu utaki hake pe koe ki a haloti puloka. Maiko haloti puloka, ke ua noa ono, nima noa wha, hiva fitu ni mataha. Ua noa ono, nima noa wha, hiva fitu ni mataha, koe liko sio te. Ko ta tau atu he, ma lo apito, tau kau wha taha i e prokalama e fini, whamore peka pauna e yahaki i tono no, ka koe whaipe le reitaha. Whina muta whao a kau sirivia taime aho, pēr whakea neta tua radio engineer. Tomorrow koe aho ia whakahoko tai prokalama ko ia e koristo tuku o e koristo tupo. Tua au wha